Hey everybody, this is Mr. Mom coming back at you again with another APGov video. We're taking a look at topic 4.10, our second video in this series, focusing in on ideology and social policy. Now, last time we were here, we were kind of introducing the idea of social welfare policy, and we were looking at specifically the most important of all, the granddaddy of social welfare entitlement programs, Social Security. And we talked about how it's funded, how benefits are doled out. And we also focused in on a big, important problem facing the future of Social Security, and that is growing insolvency. That the reserves are, depending on what economist you are going to want to talk to, is going to be evaporating in the next 10, 15 years. Now, this, when you watched into that last video, you might be kind of going into convulsions thinking, oh my gosh, what's going to happen to Social Security when I need it? Well, understand that there are solutions that can be, generated to address the issue. And in fact, the math for it is not very difficult. If you want to be able to find solvency in the Social Security fund, you can raise the taxes, raise the 6.2% tax to something higher. You can reduce what the benefits are in the future. You could also raise the age at which you could collect. We've already seen that done already once. So the math is actually very easy if you want to, make Social Security solvent. So why hasn't this happened yet? Well, as some of you may, come to the conclusion already, it's political. Do you want to be the member of Congress that voted to delay the age at which somebody collects Social Security? Do you want to be the member of Congress that votes to raise the taxes for Social Security income? Do you want to be that person? So understand that, the math is easy, but solving the problem of Social Security is politically very, very difficult. People don't want to pay a higher tax rate. People don't want to have more of their income taxable for Social Security. People don't want to have to wait longer to collect. So understand that, and of course when you add to the fact that there are no better procrastinators, even better procrastinators than high school teenagers, than the U.S. Congress, that's going to kind of explain why we're in this kind of a critical situation. Will this be turned around? Yeah, probably. But the downside, though, is probably going to be done in a way that will probably be a mix of something like an increase in taxes, an increase in taxable income, and delaying the age at which you collect. So that may very well be the solution. So keeping that in mind, Social Security is just one of many important social safety nets policies that we have. Now, Social Security is designed to help people in terms of staying out of poverty, particularly if you're talking about the retired. But we also, of course, have social safety net protections for people based on health care. And the most well-known of these is Medicare. Medicare was started in the 1960s as part of LBJ's Great Society. And the idea being is that those that are of an elderly age should be able to access health care. Health care should not be something that bankrupts you. And of course, as you get older, that's just inevitable, you're going to need more access to health care. So this is where Medicare comes from. Now, Medicare is going to be funded in a similar way to what we see with Social Security. Just like Social Security, Medicare is what we call a non-means tested program. In other words, everybody that works pays into it. It does not matter how little you make, doesn't matter how much you make, everybody pays into it. Which also means, like Social Security, you get it. Just like LeBron James pays into Social Security and he technically will receive Social Security, same thing for Medicare. LeBron James pays into Medicare and he'll be eligible for Medicare when he reaches retirement age. So with that being said, what are the numbers? Well, as you can see, the numbers are a little bit different than what you see with Social Security, with it being 6.2%. For Medicare, it's 1.45%. So it's a much lower tax rate. But note, it's also being paid by you and your employer, same as Social Security. And note, this is an additional tax to what you are paying beyond your federal income tax, beyond your Social Security tax, beyond your state and possible local income taxes. This is an additional tax that you pay into. Now, just like Social Security, you pay into it throughout the course of your working life. And in this case with Medicare, when you hit 65, then you become eligible to receive Medicare. And Medicare is just basically a government-funded health insurance program. That's really what that is. And paying into it gives you some automatic benefits. And that's what we call Part A of Medicare. Part A of Medicare is talking about, the most important health care that you would need at the most critical time. So in other words, if you fall and break your hip, Medicare will cover the cost of your hospitalization. It will also cover the cost of some of the, home nursing care that you might need once you return home from surgery. So the most expensive, most significant medical bills that you might have as an elderly person, that's going to be covered by Medicare. But note, it doesn't cover everything. It's just the most important stuff. For almost everybody, you're going to need, some assistance to pay for medical bills that are not just for, emergency situations, regular doctor visits, checkups, things like that. Well, if you want that through Medicare, you can get that, but you have to pay more for it once you receive the benefits. Note, Medicaid that you just get is just a partial thing. If you want more, then they have what's called Part B. If you want that, that's additional insurance to cover for your regular doctor's visits, outpatient, surgeries and stuff like that. That's an extra cost. And then beyond that, starting about 15, 20 years or so ago, the George W. Bush administration is going to add what we call Part D Medicare, and that is covering the cost of prescription drugs, which, once again, almost every person over the age of 65 is using some sort of prescription drugs, and those drugs are historically pretty darn expensive if you don't have health insurance. And so, Medicare, from its basic setup to its additionals, B and D, what that does is basically allow people to be able to afford necessary health care when they need it most as they get to an advanced age. And once again, this is a health insurance program. It's government-run health insurance. But the key thing here is for people 65 and older. Now, at the same time Medicare comes out as part of the Great Society, we see another similar program. This is Medicaid. Now, Medicaid is another health insurance program like Medicare, but instead of it being geared towards elderly Americans, it is geared towards impoverished Americans. So what this means is, unlike Medicare where everybody pays in and everybody gets, Medicaid doesn't work that way. You have to qualify to be able to receive Medicaid. Not everybody gets it. In fact, most people do not get Medicaid. In order to qualify for Medicaid, you have to prove that you are of a significantly impoverished financial status. So the idea being is that if you are already qualified for some other means-based tested program, like, for example, if you are collecting SSI or if you're collecting TAMP. TAMP is kind of what we normally think of today as modern welfare payments. If you're making 33% below the poverty line, if you qualify, if you meet any of those standards, you then qualify for Medicaid. So it's really for the poorest of Americans. I mean, at the very, very bottom financially. Note, how is Medicaid funded? Well, Medicaid is funded in a joint venture between federal government payments and state money payments. So it's not automatically taken out of your paycheck like, say, Medicare tax would be. Now, since Medicaid is paid out, since it's paid into by the federal and the state government jointly, it then also means that the benefits you get under Medicaid are affected by what state you reside in. And, as one could probably, assume, given the ideological leans of, conservatives versus liberals, those that tend to live in more liberal-dominated states, like, say, Massachusetts or Minnesota or Oregon, you're more likely to receive more Medicaid benefits than if you are residing in a more conservative-dominated state, like, say, Wyoming or Alabama or something like that. So where you live does affect in terms of what kind of benefits you would get under Medicare. So once again, remember, Medicare for the older Americans, Medicaid for the poorer Americans. But that then leaves the question of, what about everybody else? Well, in our country, for the, the kind of the typical, average adult that is working, is not below the poverty line, is not, elderly. For the vast majority of Americans, they get their health insurance through their employer. Some folks, are able to become self-insured by owning their own business. Sometimes you see that, but for the vast majority of Americans, they receive their health insurance directly through their employer as part of their overall salary benefits. Okay? And that's great, and that works fine for, millions and millions of Americans. But what if you work for a business that doesn't provide health insurance? What do you do in that situation? And that situation was most affecting what we would call the working poor. Folks that are working, in fact, typically working full-time, but because of their employer, given, maybe it's given it's a relatively small business, or it's just not something that the company decides to use as part of their benefits package, they just don't get health care as an option from their employer. So what do you do in that situation? Well, you're in a very tight spot if you find yourself having to go to the hospital, if you have to have a surgery, if there's an accident of some sort. And, we saw by the beginning of the 21st century that the number one source of bankruptcy for people 40 and younger was from healthcare costs. And it's mostly folks that did not have insurance, having to have some major event that required medical care and not being able to afford it. So this idea of, what do you do with the folks that make too much money for Medicaid, they're not old enough for Medicare, they don't have an employer providing insurance, what do you do for these folks? Well, this was the basis for what is going to be known as the Affordable Care Act, aka Obamacare. And, we use those terms interchangeably. ACA, Affordable Care Act, Obamacare, it's all the same thing. And what this is actually an umbrella of a bunch of small things that collectively creates a really big thing in terms of how people are going to be able to access health insurance, what health insurance providers are going to be required to do, how it's going to be funded. And also note, it is going to be, as many of you probably already know, one of the most controversial policy decisions of the 21st century so far. And in fact, there's so much to it, we can't get to it in the rest of this video. We will get to it in the next video. We'll see you then. Bye-bye.